Great. Well, good afternoon and welcome everybody to our penultimate members webinar for the financial year. I'm really pleased to see so many people on screen this afternoon. These have proved to be quite a popular innovation across the Trust, and we've had the opportunity to explore various different services and partners actually across the year. The format for these sessions is a relatively short presentation from colleagues from the service, and in this case we've also got one of our partners, Sharon from the Reach Collaboration, with us too, and that will hopefully give everybody a good idea of the service that we're going to be looking at this afternoon. Following that, there will be the opportunity to have a discussion and to ask any questions that you may have. Just in terms of getting the best out of the session, we will take the opportunity to mute people that are not presenting or asking a question, just to cut down on any background noise that we may have. We would encourage you throughout the presentation to use the chat function. If you have access to it, you can pose us a question using the chat function or capture any thoughts as you're going through. We will endeavour to pick up questions towards the end, but if we don't manage to cover them off before we finish, we will endeavour to respond to people following the session with an answer. Of course, this being a general information session, we're unfortunately not able to address any individual matters about clinical care, but if you have got an interest in talking to somebody about your own care or that of a loved one, we can signpost you to a relevant person after the meeting so that you can get that question answered. As we've already mentioned, we are recording this afternoon's session. This is so that we can make the recording available on the website for those that can't join live, and we've had quite a bit of interest from people that aren't able to attend live in some of our previous sessions, all of which are available, as I say, through our website if you want to look at the other topics that we've covered throughout the year. So all that remains from me then is to hand over to Erin and the team to introduce themselves and to step us through Child and Adolescent Mental Health Services, or CAMHS, for this afternoon. So Erin, over to you.
Perfect. Thank you, Richard, for that introduction. So both myself and Sharon have got Womersley, who works with the Reach Collaborative. We've got two smaller presentations to present to you, because we've got Reach, who we work alongside quite closely, and that kind of works with lower level mental health. So we thought it might be helpful to start with that, and then obviously I can work through all of our other CAMHS services that we've got on offer for NHFT. Sharon, are you happy to do your presentation first, and then I can follow, because it just makes sense to start with lower level and moving on to moderate to severe. Is that okay? Perfect, thank you.
That's absolutely fine. Okay, so I'm Sharon Womersley from the Reach Collaborative, and the Reach Collaborative is made up of 5 what were youth counselling agencies that cover the whole of Northamptonshire county. So we endeavour to provide as many services as we can across the county. If you want to go to the next slide, please. So who we are is that we're commissioned by the ICB to provide support for 5 to 25-year-olds. There's different levels of service for the different age groups of young people that we're supporting, and but there are also other services that we provide in our individual agencies that are funded through other sources, but it's all around supporting 5 to 25-year-olds. It is the next. Yeah. So our purpose is to provide services for young people and their families to have free and timely access to evidence-based early intervention services that improve their mental health, emotional well-being and resilience, so that they can cope with challenges that they may have in the future. Next slide, please. So just going to show you who is looking after which area of the county. So the East Northants area is looked after by Chat and Service 6, depending which side of the A14 you're on. Corby and Kettering is looked after by YouthWorks. Wellingborough is looked after by Service 6, Northampton is looked after by Lowdown, and the rest is looked after by Time to Talk in Daventry. So it's quite a large area that they have to cover in the county. Next slide, please. So who refers into us? Basically, we are a free to access service, so nobody pays for any of the services that we provide, whether that's funded by the ICB or elsewhere. And we do get professional referrals through the referral management centre, so from GPs, school nurses, etc. But young people or their family can self-refer through the individual agencies. So it is an open access service for young people, and professionals should direct their referrals through the RMC because then they can provide us information that they already know about the young person, so the young person doesn't have to repeat that. But that is how a young person will receive our services. In all cases, it's important that the young person is aware of the referral and that they have agreed to it, because you know, we're supporting their mental health, and if they're not wanting to engage in the service, however much a parent thinks that it's important that they do, unless they want to, it obviously wouldn't work. And then obviously for any of the young people under age 13, we need to get parental consent for them to access the service. Next slide, please. So as Erin said, the REACH collaboration is looking at the lower level support. So I joined the Lowdown in 2019, and at that time we were only doing Tier 1 and Tier 2 work, so prevention and promotion and coping with early intervention, getting advice and some problems, but managing their day-to-day activities. But it was recognised there was a gap between the young people that were using our services and the young people that were using the CAMHS, met the threshold for the CAMHS service. So we've worked together to develop some Tier 3 support as well, where young people are struggling more with their mental health, and you know, we have the qualified counsellors to support that. But obviously we would refer and do make referrals to CAMHS for those young people that need that level of support. Next slide, please. So what are the things that we are supporting young people with? Over the last 4 years, that has developed quite significantly. So I would say in 2019-20, it was early 20 before the pandemic. It was self-esteem and confidence, anxiety, low mood were the main presenting issues, and they still are today, family relationship problems as well, and they still are today. But we have seen a significant increase from the pandemic in the number of young people that are self-harming and who have suicidal feelings. And there's also been an increase in the number of young people who experience loneliness. They've become quite isolated during the pandemic. And then, as a lot of people already know, there has been an increase in disordered eating as well. Next slide, please. So what services do we offer as REACH? So as I say, we've been on quite a journey over the last 4 years, or five, 6 years, because the REACH Collaborative came together a couple of years before I joined. So we offer one-to-one counselling and emotional wellbeing support at level 2 and at level 3, at Tier 3 for young people as well. And in that counselling service, we predict that this year we will deliver 22,376 counselling sessions, which is quite a considerable jump from where we were a few years ago. And you'll see some figures of what we would normally have delivered just from the public health funding that we got in the past shortly. We also have a rapid response Fund, which is also for counselling, but it provides immediate access to counselling for young people who have seriously self-harmed or are at serious risk of serious self-harm, and who have intense suicidal feelings as well. So within 2 days of a referral, the young person will be contacted, and within 5 days they have to be into the counselling support. And those young people can be referred through the RMC, but can also self-refer, and we will triage the self-referrals that we get into the service and escalate those young people if we need to give them the support that they need. So those are the 3 counselling services that we're offering for young people. They are for ages 11 to 18 for all of those. The Happier Families programme is a programme based on the 10 keys for happier living, and it is a low threat is how the person who's put this together would describe it. So it's about engaging young people and their families to create closer relationships based on the 10 keys for happier living, and having an understanding of one another better to improve their relationship. Then we have, and that is open to primary school children up to 18, because it's a family intervention, so we can have young people of all ages in the families, and that can either be delivered with one family or a group of families, depending what is most appropriate for the families concerned. We also have Espresso Yourself Wellbeing Cafes. So these are really easy access. So they're open 6 days a week across the county, and any young person can go to any of those cafes. I'll go into that in a little bit more detail, but that is a great service because there is immediate support available for young people 6 days of the week. We also have LGBTQ services, which are run currently in Corby, Kettering, Northampton, Wellingborough and Daventry, and they provide youth groups for young LGBTQ young people, as well as they get involved in pride events that happen in the towns, and residentials, and all things to help young people improve their confidence. We do a specific prom for those young people, because it's not always the best place for them to have their prom at school, especially if they're a transgender young person. So we have those services across the county, and all of these services are growing all the time. So it started in Northampton and Kettering. They were running youth groups pre-pandemic. Corby, Wellingborough and Daventry have come on post, and Daventry just started in October, but they are all well attended. And then we have a restart service, which is supporting young people who are aged 16 to 25 who are transitioning from CAMHS to adult mental health services, but it's providing practical support to those young people for anything that they need to help them thrive. And then this year we've also launched a Happy Heads programme, which is supporting the under 11s. We see this as quite a growing area, unfortunately, of young people that need support, and that is again low-level interventions that are helping to support young people to build their resilience. So in 2019, only 2 of those things were in place. Well, 2.5 of those things were in place. So it's been developing all the time during the pandemic, as we know that the demand for all our services has been increasing. Next slide, please. So this was just for the Tier 2 contract that we delivered for last year. So we delivered 12,727 counselling sessions and saw a 38% increase in referrals into youth counselling, and supported over 3,000 young people. Those numbers are growing all the time. We did have 592 young people on the waiting list. That's slightly lower at the moment, and 96 97% of young people were supported within 13 weeks, and the average referral to treatment time was 7 weeks. One of the, well, two important figures, because it's not just about seeing the young people, it's about having the outcomes that those young people desire as well. And 84% of our clients showed a maintained or improved core score, and a core score is the measurement of their emotional well-being. And 92% of young people who've used our services would recommend them to others. So I think that is quite considerable achievement, considering how much we've been growing on top of providing the support to young people. Next slide, please. So just going into the Happier Families programme a little bit more. So it's about exploring ways to build the family's happiness, to learn tips to try when they're struggling to build happier relationships and enjoy their family time together more. And this is it's worked really well. So I was just a couple of weeks ago in the Lowdown building, and there was a young person whose mother unfortunately was quite seriously ill, and just seeing them coming out of a session with their worker, you know, despite the challenges that this family are facing with physical health, never mind mental health, it was just heartwarming to see the impact that that is having on a family. I say that because I wouldn't normally, it was only because they were coming into the waiting area, I wouldn't normally see that. So that was really good to see. And then next slide, please. So if we talk about the Espresso Yourself wellbeing cafes, so these are open to 11 to 18-year-olds across Northamptonshire. So any young person anywhere in Northamptonshire can attend. We've got 9 cafes running across the county, Monday to Saturday. So we've had a new one in Raunds and a new one which launched at the end of November, and a new one in Towcester as well that launched just at the beginning of January. So we're trying to increase the coverage for young people, and they provide immediate access to support across the county for young people and their families. So the young people can come in with their parent or carer and both be supported in the cafe. And this has proved to be quite a success in a number of different ways. So in the same way as Erin is about to talk about, I'm sure waiting times for our services are not always what we would want them to be. And if a young person needs support, they need support now. Well, this is something that they can access every evening or on a Saturday during the daytime. So that is a good thing. But it also helps young people to build trust with our organisations. So we've had young people who've taken quite a long time coming to the cafe to build a relationship with our organisations before they would trust us to go into counselling with us. There are also young people who've been in counselling with us, and you know, some of the tools and techniques that they have learnt during counselling to help them with their loneliness or self-esteem, they can come into the cafe and practice those skills. And we've had one young person that has been supported by the cafe for a year. So it's important to say that young people can come in and use the cafes as often or as little as they want to. It's about them, as long as they are there for their emotional well-being. It's not a youth service, but this young person has accessed the cafes for 12 months, and the difference in her confidence and self-esteem because of the wellbeing activities and peer support that there has been in the cafe has considerably increased her confidence, and so much so that she now wants to support other young people in the cafe and volunteer for the cafes as well. So that is a new development that we'll be seeing in the new year. In the new financial year. We also have in the Northampton cafe a pet therapy dog that will do walk and talk with young people, or the young people can just come and chill with the dog, and that's been really helpful as well, because it really reduces the anxiety of the young people that are using our services. So we're always looking at how we make our services accessible as possible. Next slide, please. So then we have our LGBTQ support. So there are youth groups across the county from Monday to Friday. So we always try to make sure that they're on different nights. So if a young person wants to attend more than one group, they can, as long as they've got transport. No, that's not always the case, but they are there to support young people, and that helps them to be with like-minded people, to have a safe space to explore their gender identity or sexuality and or sexuality. So those are proving really good support for young LGBTQ people. We also have a Facebook group that supports the parents and carers. One of our low-down staff runs that, but it's open across the county. And we also have a parents and carers social the third Thursday of every month to support the families. That hasn't been as successful as we would like it to be, but we keep persevering with it, because we know how difficult it can be for a parent who is supporting a young person, particularly if it's a transgender young person. Next slide, please. And then we go on to the Restart project, which, as I said previously, is providing practical support for young people transitioning from CAMHS to adult mental health services. This service started in April, and already we've had over 1,000 contacts with young people, and the kind of things that we're supporting young people with, because it's a practical support and not an emotional support service, is homelessness. Unfortunately, you know, young people who are struggling to manage their money, and immigration issues have also been a problem as well. But it is a service that basically supports the young person with anything that they want to work on. So it could be getting into education, getting into work, etc. So it's helping young people across the journey, as well as making sure that they access the support that that they need to for their mental health. Next slide, please. Then we have an under 11s support service. Again, this was launched in this financial year. They work closely alongside the mental health support teams in schools, because they are offering a similar intervention. And this is 6 sessions of either one-to-one group work or class work, depending what is suitable for the young person, and equipping them with a way to manage their emotions and feelings when things get difficult, and to build their resilience. That has been a really successful service this year, and unfortunately the referrals are closed for that at the moment, because there's been so much demand. But I know that the ICB is working hard to get funding back into that area, so that we can continue that support. Next slide, please. So then how you refer into our services. So as I said, we do get professional referrals from GPs, school nurses, etc., or CAMHS themselves, and they come through the referral management centre, which the contact details are there. And then we get self-referrals through each agency's website, and then there is, if you just press the slide again, there is all of the contact details of all of the Reach partnerships. We all do have online referral forms, but if anybody was struggling to fill one of those in, they can call our agencies, and we would of course support getting all of the information that we needed to process their referral, and to make sure that they receive the right level of support, if in fact it is the Reach partnership that is the right place for them, and if not, we would help them to make an onward referral to the appropriate service. And that's it.
Thank you for that, Sharon. That was really helpful. I'm happy to just move on to mine and then everybody can ask questions at the end. Is everybody okay with that? Yeah? Okay, let me just share my screen. Can everybody see that okay?
Yeah.
Yeah, perfect. So just to introduce myself, my name's Erin Riley and I'm the service manager for core CAMHS and CAMHS Connect. I do have a bit of knowledge about most of our services, but I do have other CAMHS colleagues here if there are any questions that can help out if they need to. So I'm just going to follow through on this presentation and hope that you've got some questions at the end. So this is a bit word heavy, this slide, but I thought it was really important that we look at CAMHS service as an overarching service. So we have 3 directorates. We have Children and Young People's Universal Services, Children and Young People's Specialist Services, and Children and Young People Mental Health Services. And the stars indicate these areas that offer a form of mental health support for young people and families. So I thought it was quite helpful to have something like this to show actually how much we've progressed services, to look at children's needs and young people and families as a whole, to make sure we're offering the support that's needed and tailor making that approach. So yeah, so there's quite a lot of services. So we've got the 0 to 19 teams who work with young people from 0 to 19. And then we've got some of our specialist services, so thinking about paediatric psychology, ASC and ADHD service, community eating disorder service, and then going on to some of our mental health specialist services, so our inpatients, our IOT and intensive outreach, crisis teams, core CAMHS and Connect, which I manage, and then our mental health and schools teams. And then we have our participation team, which helps with quality improvement and participation with these services as well. And now it's not going to let me go on to my other slide. Sorry, 1 second. Let me just bring up here. 1 second. Can you see that? Let me see now. I might just do it like this. It might be easier. Can everybody see that slide?
Yes.
Yeah, okay. So moving on to just kind of what Sharon was saying about the Thrive framework, which we also use within our services, and it's thinking about getting advice, getting help, getting more help, and getting risk support. And the Thrive framework is more about looking at young people as an individual and recognizing that actually all of our young people don't fit within one service. There's very much a good chance that they will move through services at certain points throughout their life. So they might be and I'll come on to that in a minute, but they might be using some of our reach services, and actually then their risk might increase and they might need to move up to our core CAMHS service, and vice versa. They might need to access our crisis service. So it's looking at like a tailor-made approach for young people and not just fitting them in and making sure they fit in one box. So that's kind of why we've moved towards looking at a Thrive framework and thinking about the young person as an individual and what that mental and emotional well-being support looks like for that family. So just kind of, so some of the reach stuff is in here already, but this is looking at, again, CAMHS offer. So the CAMHS offer a while ago, prior to all our extended referrals that we've been getting in, was kind of just very limited. But obviously recognising the increase in referrals that we've been receiving regularly over the last few years prior to COVID, we've looked at accessibility into CAMHS and actually looked at what's going to be helpful for the young people and family and kind of put it into this Thrive House, which kind of hopefully makes sense. So the getting advice is kind of the lower level support, and that's working with our Reach collaborative and our mental health and schools teams. So that was a pilot project that started in 2021, and every year we've added to that to try and increase accessibility for our young people and families, and I'll talk about that a bit more in a little minute. And then you've got like your CAMHS Connect consultation line and CAMHS Live, which is a service that's offered through our our CAMHS service NHFT. So CAMHS consultation line is about getting advice and guidance for young people and families and professionals if they've got a young person that they need some emotional and wellbeing advice about. And then our CAMHS Live is a chat room that function that we offer for young people up to 18 to access that live in Northampton. They can use that chat box to speak with a clinician to seek some advice and guidance as well. And then again, talking about the wellbeing cafes, which and the rapid response, which is also part of the reach. And then it moves on to kind of moving up a level to getting help, which is obviously our ASD and ADHD service, which is a diagnostic service, and a core CAMHS, paid psychology and community eating disorder service, which is a bit more specialist, moderate to severe mental health. And then our looked after children, youth offending service and NSTEP, so early intervention psychosis. And then it moves on to risk support. So we recognise that actually our young people, as I say, can move between these services. And that's what we want to encourage. We want to make sure that we are collaboratively working with young people and families to access the right service at the right time as well. So then getting our risk support is thinking about our CAMHS crisis, an IoT team, as well as our CAMHS inpatient. So IoT was a recent, over the last few years, part that we've put in place to support preventing admissions into hospital and trying to keep young people at home with families, which has been really productive in reducing admissions as well. So thinking again about how we access our young people's mental health services. So thinking again about getting advice, we use the NHFT Children's Resource Hub, the CAMHS consultation line, which I've just spoken about, and our 0 to 19 hub. Getting help, we work with our educational colleagues in schools, Chat Health, Reach Collaborative and mental health supports teams as well. And then getting more help, we've got our referral management centre, which is also what Reach use, and that's referrals from schools and GPs as well as wellbeing cafe drop-ins. And then getting risk support, we work closely with A&E, police, CAMHS crisis, our wellbeing cafe drop-in, social care, and the youth offending scheme as well. So our online website has just had a bit of a revamp to make it quite, well, hopefully easily accessible for our young people and families to use. And this is kind of what it will look like. So it's tailor-made to kind of, once you press on these links, depending on the age of the child, it will move into what offer is available and what support's available within Northamptonshire for families as well. And it also brings you into this. So it thinks a little bit about what you need. Do you need to speak to someone? Do you need some advice and guidance? And how do you access that? So we've tried to improve accessibility to our website as well. So just thinking a little bit more about referrals to CAMHS and Reach. So they must be made electronically. That's how we use our referral system through the Referral Management Centre. And Sharon's already spoke a bit about the Reach Collaborative and how they use the referral system. So we use it like this as well. So registered with a GP in Northamptonshire, age 0 to 18 years old, presenting with signs of ongoing concerns of mental health difficulties that are impacting on development functioning or likely to result in significant risk to themselves or others. Less intensive interventions hasn't been worked or is unlikely to suffice, and consent has been obtained from the young person, parent or carer. So this is looking a little bit at local inequality impact, how we need to deliver our services. So this is thinking about some of the statistics more recently that we've used to develop our services. Thinking about there are more reported domestic abuse incidents in Northamptonshire than in other parts of the UK. Less children take up early years educational offers. Young people are becoming looked after in Northamptonshire. Free school meal status have worse than national average achievement in phonics at the end of year 1. Low volume of early help assessments, more hospital admissions as a result of substance misuse, and more hospital admissions as a result of self-harm and mental health conditions. So these are the reasons why we're trying to look at working in a more collaborative approach and looking at services that we can work closely with to try and look at that young person and individual, and not just try and fit them into a box as well and what the need is. So dealing with the wait, so we recognise that obviously CAMHS services, sometimes for specific services, there's quite a significant wait. And that is something we've recognised for quite a while now, and that we're trying to tackle with some innovation and working with co-production with young people and families. So mental health supports teams and schools is growing. So this started in 2021. We're currently at 7 teams around the county, and we're expecting it to grow to between 9 and 11 by next year. And again, that is just making sure that we are able to access those young people at earliest opportunity within schools, and helping to upskill schools and recognising mental health and increasing the accessibility again. I spoke a bit about an intensive outreach team. And that's looking at avoiding admissions to hospital as well. So what our intensive outreach team does is dependent on the individual, but they'll work with young people that are either just being discharged from an inpatient unit to try and integrate them back into community or manage risk presentation, or they will work with young people that we're trying to prevent going into an inpatient admission and think about what their need is. And it might be that they see that young person 2 or 3 times a week over a period of time to try and prevent that admission and work with that young person and work on what is escalating the presentation. Wellbeing cafes, which Sharon has already touched on, which is again increasing accessibility and working extremely well. And carer peer support workers, so working with families that have had lived experiences, so them coming in to our services and working with families and young people who are in the middle of crisis point or breaking point, and recognising that actually they've lived through this and seen the light at the end of the tunnel. So we're at the very early stages of doing that as well. And then clinical risk reviews within our core CAMHS service for our psychological therapies. We recognise that there's a significant wait for some of those, and that actually there was young people on wait lists for quite a substantial amount of time. So what we've started to put into place is every 12 weeks, a young person that's on a wait list will have a clinical risk review. And that's looking at young people and families, making sure that the mental health presentation is still the same, they're on the right pathway, awaiting the right treatment, nothing's changed. If something has changed, we can look at prioritising and changing, and also looking at if there's any other organisations that we can work alongside to support that young person and family until the psychological therapy that they're waiting for is available and ready. So the planned innovations in the next year, we are also putting into place 2 practitioners to work in GP surgeries, 2 PCNs currently, to pilot it and see if that will again increase accessibility into our CAMHS service, and also give knowledge into what our services are. And triage as well. We're looking at new digital access products, and that's in the very, very early stages of co-production with young people and families of what they might find useful for us. We're also looking at transition strategy, and that's about making sure we can transition young people from CAMHS to adult services a bit more seamlessly as well, and make it helpful for the young person and it not feel so disjointed. And Discovery College is something that we're exploring as well, and that's about making sure there's resources available for families and young people to access, which is evidence-based as well. So moving on to our next slide. So just recognising, I've kind of touched on it throughout, but recognising that actually the impact on a young person's well-being is multifaceted. It can be CAMHS, mental health issues and emotional well-being, but it could also be a range of other things. And it's recognising that actually it won't be that we need to work alone with a young person, but actually in general terms, we likely need to work with many different professionals to meet the needs of this young person as well. And it might be social care, or it might be education, it might be both, it might be other organisations that we work to try and meet the needs of the young person, but all of these can play an impact into somebody's emotional well-being and mental health. So we thought it might just be helpful to put a bit of an example of how we would promote outcomes for young people. So we've got a 14-year-old young person under core CAMHS for moderate to severe mental health presentation. Zara has low self-esteem and struggling to build friendships at school. She's been self-harming for a year and sometimes needs crisis support, so accessing our crisis team. Her main worries are around anxiety. So she's working with our Activate programme to build up her skills in social activities and resilience through physical activity. CAMHS are working closely with Zara's family and teachers, and an early help assessment has brought together services that can support the wider needs of the family. So this is just thinking about actually one of our group offers at the moment is our Activate group that work alongside the Northampton Saints Foundation. And we are also working and starting to build up working kind of relationships with other services, which includes the Frank Bruno Foundation for anger management, social care, the Job Centre Plus, in schools and the performing rooms as well, which is music-based activities that young people could access. And just going back to the Activate group, this is a programme that's offered in core CAMHS to support young people with kind of self-harming, low moods and anxiety symptoms, resilience building, self-esteem building. And it's normally about a 10-week group that's offered, and the young people get together. They're all triaged for this type of group. They get together, they arrange through themselves what kind of activities they'd like to do, and try and push themselves out of their comfort zone and link it back to thoughts, feelings and behaviours of how they felt through it. And again, linking it back to kind of wider knowledge about how they are in their community as well, and how they would then engage back into their community. So that is something that we do offer within core CAMHS. And then I just thought it'd be helpful to have some feedback. I'm not sure if you can see that. Let me just make that a little bit bigger. Feedback from our group offer, which is Engage, who works with the Northampton Saints. So without breaking my son's trust, CAMHS worker made me as a parent feel at ease that he was engaging in the programme and checking that things at home were improving and no other issues were happening. Improvements, I don't think anything else could have done as could see the improvements in my son. Very well organised, leaders were very approachable and cared. Activities enabled my daughter to try new things and socialise. CAMHS worker went out of her way to get to know the young person before starting the group to make him feel more comfortable. And the young person was very anxious prior to Activate, unfortunately, still is. So it's not really benefited him in this respect. However, he did attend all sessions, which is very unusual for this young person, and actually enjoyed the sessions. And I thought that was really helpful to put in here, because actually we can't cure all the time and we can't help all the time, but actually this young person made a big step and being able to engage in the programme despite the level of his mental health is at, and actually enjoyed it as well. So although it didn't help him overall, he was still able to kind of overcome that hurdle. And young person enjoyed all aspects of the group, no problem, wishes it could continue. So I just thought that might be helpful to put some feedback in from some of our young peoples and families. And I'd welcome any questions that you've got.
Thanks so much, Erin, and thanks, Sharon. Yes, some really helpful setting out of the fantastic offer, it seems, that's available to people across Northamptonshire. So many different services and solutions, it seems. So if I could just remind people, if they have a question, either to put the hand up or to put a comment in the chat, and we can start to work through those. I guess whilst people are thinking about that, one of the things that struck me is just how much innovation is going on in both services, with new ideas coming forward, and equally how much this is a partnership approach, not least because NHFT is working with the REACH collaboration, but with schools and with other agencies. Can you say some more about how you're coming up with all of these ideas about how to solve some of these health challenges?
I think it's working with our young people and families. We've got this massive co-production team now, which Joe Fletcher leads on, and actually it's been really, really positive to it's silly things to us in some respect, but actually some of the names of our pathways in core CAMHS is the young people have came up with it. We've got our young people and we're encouraging them to absolutely engage in all of our interview processes, and families as well. And again, the carer peer carer, support workers. It's about what works for these young people and families. Yes, we work as a service, but actually we don't use the service. Some of us may, but some of us don't. And actually our young people are the ones that are the lived examples, aren't they? And they're the ones accessing it. And we need to make sure there's something there to access that they need.
Brilliant, thank you. So we've got a couple of hands up, so we'll come first to Susan.
Sorry, 1 second. I'm just trying to get my camera on. No, hi. I'm Susan. I'm a patient governor for the NHFT. I just had a few questions. I was going to ask about activities, but you did say it a bit later on. But the type of activities I was going to ask, you were mentioning about like the pandemic and how patients, like it's risen. But I was just wondering, because the pandemic took us away from our friends, and young people going through the system, because of like the pandemic kept them in, they wouldn't have had chance to sort of like they wouldn't have had a chance to make that sort of friend sort of bonding. And I was just wondering, it's coming up to the summer, and it was just an idea that crossed my mind. You mentioned about the cafes and going for dog walks, which I thought was really great. But I was just wondering, like, you know, the fairs and stuff that go on, you know, like if there was anything arranged just for that walk, like going to fairgrounds and stuff, because I think that's sort of like the increase sort of like self-harm and stuff like that, because when you're transitioning from services and stuff, I mean, the idea, the game of it all is that they learn to go off on their own as such, and look after themselves and make all that you know, them bonding relationships, because I think sometimes we can depend quite a lot on services. And one of the lessons that, like, I think, but do you know what I mean? Like, friends and family are really important, and I like the work that you were doing with families as well. But I was wondering if, like, maybe promoting that a little bit, you know, just the walk, or like, I mean, the patients would have to pay obviously to go on the rides or something like that. But I just thought, coming up to the summer, is that something that you would suggest or think about doing for the young people?
Yes. Can I speak about that, Erin? Is that okay?
Yeah, that's fine.
Okay.
Yeah.
So it is a really good point, Susan. So our LGBTQ group, for example, during the so we were then in 2021, when things opened up a little bit more, we organised a summer of so many activities. So there was a Northampton Pride. We took them to a residential. We took them to the theatre, just so that they were out and about again, which they'd been so isolated that that was something that we recognised was really important. They had been meeting online during the pandemic, but that obviously isn't enough. It's face-to-face contacts that we need. In the cafes as well, there are activities that go on, wellbeing activities in the cafes that the young people can be involved with, and you know, they do get conversations with their peers and the parents as well of the young people that are using the service. So that is working really well. But there is so much more that we can do, and one of the things that Service 6 and YouthWorks have got really established youth groups that they have for their young people, where they do those kind of activities, and that is something that the Lowdown as well will hopefully be developing during this financial year as well, because it is about the everyday relationships. And you know, when you hear in the cafe that somebody has built a friendship in the cafe, you know, it warms our heart, because that's what it's all about, making those connections and getting the support that people need.
Lovely.
I hope that answered your question.
Thanks, Sharon. Okay, I think we've got a couple more hands. We've got some questions also in the chat. So we'll come next to Chris.
Yes, can you hear me okay, everyone? Yeah.
Yes, well, thanks.
First of all, thank you, Sharon and Erin. It's a very detailed, comprehensive explanation, really, of all the good work that's going on behind the scenes. And there's so much to admire, really, about the partnership working, the joined up working. And if I may, I'm going to offer two reflections leading to a question. And we all know, don't we, that the pandemic has absolutely resulted in an increase in mental health disorders in children and young people. When I last looked, I think there was over 500,000 referrals in total to CAMHS in 2021 compared to 400,000 the year before. This year another 33% year on year. And we know that this is, for me, probably one of the issues of our time. And I say it as a dad and as a granddad. And I know this is an issue that we're all working together on across health and social care. I think one thing I would say is that the public perception of waiting times in CAMHS is so far. Only today, in my role with Kettering Mind, Time to Talk Day, I was in the shopping centre, we're talking, and somebody said, well, I can't get to CAMHS because I can't get to my GP. We talk about electronic referrals. I think one of the really positive things, and Sharon, I'm a huge fan of the espresso yourself. Only last week, I've got the picture of those cafes, those drop-in facilities on my phone, because only last week I was speaking to a parent who didn't know where to go, didn't know what to do, and I signposted them to the espresso yourself cafes. And I offer this reflection from direct experience, having set up health and wellbeing days, took over an unused shop front in Kettering, brought together various partners, including the NHF school nursing service. And what is clear to me, that whether it be the issues of race, colour of your skin, whether it be social, if you like, situations, disability, people don't know where to go. They just don't know where to go. And the public perception, and this leads to my question, is that the waiting times are too long and they don't get in. And Erin, you were I'm not trying to put you on the spot here, Erin, but you were very careful with your words that there is a significant wait. My question is, what is that, please, whether it be for core services or as in universal or for specialists? So if you could help with that. I felt very reassured that every 12 weeks you are undertaking a clinical risk review of every young person on the waiting list, which is good practice, brilliant. But it'd be helpful to know what the waiting times are, because despite all the good work, despite all the partnership, there's still public perception is that waiting times are too long. And we need to, and this is where we as governors come in, we represent the public and members. We need to bridge and help inform that level of understanding, and particularly around the context of those other sort of health inequalities that you touched on with schools and learning and school meals and everything. So hopefully we can help in that role as governors, but it would be helpful to know, please, what the weights are that you described as significant. Thank you.
No, I think Sharon was going to take that one, Chris, if that's all right.
Okay. Hi, Chris. I'm Sharon Robson. I'm the Assistant Director for Children's Services. And I have CAMHS in my portfolio as well as all of the other children's services. So it's very difficult to give you a direct answer, and I don't want to be evasive. I think there's certain things for which there are longer waits. So for very specific trauma work, for example, we have waits that are in excess of a year. And Joe Fletcher's just messaged me to say any wait is too long, and it absolutely is. Yeah. Absolutely acknowledge that. We have other, so most of the referrals that come into our core CAMHS, which is the moderate to severe end, are for mood and anxiety. So this is low mood that is low mood and anxiety that prohibits children and young people from leading normal lives. So the waiting times for that at the moment are around 8 to 9 months. Again, far too long, and we do acknowledge and appreciate that. Without making any excuses at all, the COVID has had an impact on the numbers of referrals coming in, which have risen exponentially. And we have also found that children coming into this more moderate to severe end of CAMHS are more acutely unwell. So what we've tried to do, first of all, with the clinical reviews that we do 12 weekly, which are safety reviews, we do try at that time to see if there's anything else in the system. So really the stuff that Sharon and the REACH provide, or any other areas that we can support young people whilst they're waiting for their specific therapy. So basically, in this high-end part of CAMHS, we offer evidence-based therapy and medication if needs be. So, and quite often, you know, children would benefit from lower level, you know, so support from the wellbeing cafes and support from other services that the REACH provide. In addition to that, we are working so hard on the waiting lists. As you know, there's a national recruitment and retention problem, and we're experiencing that in Northamptonshire. And what compounds that is, so we've got a fantastic new service, mental health in schools. We're on wave 9, so we're going on to our 9th team. And we've got good coverage north, and these new teams will be covering the west of the county. But the absolute truth is, all of that new recruitment. So, so far we've recruited about 50 members of staff, all come from our existing CAMHS service. So it's almost drained our CAMHS services because they're really great opportunities. And those are the difficulties we grapple with every single day. So there's not a quick fix, and we are acutely aware. We do have a CAMHS consultation line that Erin mentioned in her presentation. The NHFT website has got access to that. So it's manned from 9 in the morning till 6 in the evening by a mental health professional who can do a facilitated referral into core CAMHS if needs be, but will also provide young people, parents, teachers, GPs, mental health advice on the day. So the waits are a big difficulty and a big challenge for us.
I know the challenges exactly. I mean, thank you for just providing some context. I think the recruitment retention issues are, as you say, a real issue, and this is a wicked problem to deal with, as you described. Certainly one of my governor colleagues helped with a school's pilot project year before last, and what was very clear in talking to them, that the school gate is their equivalent of the A&E in dealing with family problems, mental health problems, social issues. And I would absolutely applaud that as a project. That is wonderful. And there is, as I say, so much to admire about the joint working, the collaboration, the co-production, you know, which is, as I say, to be applauded. But within the context of that workforce issues and the wait, finding new ways of making sure children can access, and parents, that degree of reassurance. And certainly the work that Sharon does through the REACH Collaborative really does help. And I've certainly been promoting that to people I represent and speak to weekly. Thank you.
Absolutely. And I do have to say the wellbeing cafes have got a footfall of around 200 children a month that are accessing support and help. So I think it's been one of our successes locally, and our crisis team offer the wellbeing cafe support if a young person is in mental health crisis or distress. So there's another some good working there. But you're quite right. It's still not enough, and it's not good enough for our young people.
Thank you, Sharon.
Thanks, that's Sharon.
Can I just add something to that, Chris? So in the in REACH as well, we also have waiting times for young people to access counselling service, which at the moment is less than 10 weeks, and we do use the cafes to support young people while they wait. But one of the things that we that is so important to us is the rapid response. So when a young person really is in high need, we can see them very quickly.
That's good to hear. Thank you, Sharon. So I'll bring Naomi in, and then we'll come to some of the questions in the chat just to make sure we're not missing those. Naomi.
Thanks very much, and thanks for a terrific presentation. Just to say, I was late because this afternoon I was visiting Berrywood Hospital and saw with Sharon Robson some of the amazing work, and spoke to direct providers, which for me just brought me back to my roots. It was completely wonderful. I suppose I've got two questions, and they're both quite hard, I'm afraid. One is about, it's great to see all the innovation, but is there data collection on impact? because that's one of the things about doing something new. And it was really, it was very good that Erin pointed out a comment that something didn't work for an individual, which is, very brave and very important to do. But the difficulty is that sometimes finding out whether something works costs more than actually delivering the service, because evaluation is very expensive. And I was just wondering to what extent you could work with Northampton University or with PhD students, whatever, just to get some more data on not just do they like it, but did it actually change anything? I've always struggled with this myself.
Can I come in, Naomi, and answer your question?
Yeah.
So I'm Claire Gibson. I'm head of Children's Specialist Services. So work with some of the more specialist, like the children's eating disorders, mental health team, and paediatric psychology. And yes, so the example used earlier for the PCM project is exactly that. We don't know if it's going to work. Other people have done it in different areas, in different ways, because it suits their local area in a way they think it will. We are trying a model that we know works with a physical health presentation of children successfully in Northamptonshire. The truth is, we are going to have to evaluate that as we go along to see if it works. And some of the other examples we've not mentioned so far, but we're doing in other areas, is we've started putting in link members of staff and nurses into our mental health teams to bridge into our 0 to 19 teams. And so, for example, some of the great work that's gone in with the link nurses for early, because there was nothing for children's early intervention for eating disorders, and we've put 2 nurses in aligned to that, and they've been doing assemblies and had like 700 pieces of feedback. So teachers and young people, we are taking the feedback, but also looking at access via that way. So yes, we're trying to look at where are the quick wins, what's really effective, and we're looking at other areas as well. We're part members of clinical networks, so we get learning from other local areas, so we can see and get ideas around, okay, so we've tried this, so what next? And in some areas, like in children's eating disorders, people are looking to us because we're ahead of the game, and actually waiting lists there are doing well. So there are some pockets of real positivity. And the teams are amazing, I have to say. Even though it's really challenging out there, they're also very good and motivated and creative around engaging young people and thinking of different ways of working.
Just to say, I mean, that's all great. The point I was making, and eating disorders is really interesting, because measuring the impact should be relatively easy in the sense of, are they eating normally or not? It's that satisfaction with the service is essential, but not sufficient to prove effectiveness. And proving effectiveness is expensive. So that's the only point I was making. Of course, the co-production system builds satisfaction in, because if people have a role in the design, then they will feel much better about the service and want to use it. But my line always was, when I, had years of working with parents, if they don't like it, they won't come. Just because they like it, it doesn't mean it changed their kids. So it is, I'm just saying that this is very difficult. So I realize what I'm asking isn't straightforward.
I think it's difficult because often we won't see the outcomes until they're adults.
I know.
It's very hard for us to, it is so hard for us to count. That's the challenge. But where we can, we try and capture the outcomes for young people. And I think there is something around capturing what is a realistic outcome, because as Erin has already alluded to, there isn't 100% fix all of the time. But you can still come away from a group with lots of positives.
Oh, absolutely. Yeah. I mean, as I say, if they don't like it, then you know that it's not working, because they're not going to come. So my second question is much more, just a little bit more detail about the work with local government, and how, our ICB collaborative, Children and Young People, is led by the Director of Children's Services for Northamptonshire. And yet today, and the things I've heard, while there's mention of working with local government, what are the practical examples? How does it work? Is it okay? What should we be doing to make it better?
shall I try that? Do you mind if I answer that? I suppose some of the things we touched on, Naomi, earlier, but I would say I don't think there's one single thing, but I think what makes the fragmentation of the county makes it very difficult.
Yeah.
The fact that we're now 2 unitaries and the academisation, because I think at the moment, the most, as we reach out, it's really difficult to get schools to kind of get together, when they were in local authorities, and I know there were problems there as well, but you'd put out one narrative and everyone would know the narrative and kind of sign up or not or whatever. So I think if I had to cite one of our biggest difficulties, I think that would probably be it. That fragmentation about 2 unitaries, a children's trust, a health service, and we've got 2 acutes, 1 community. It is very fragmented.
Yeah, I agree. Okay, thank you.
I think just to add to that though, Naomi, as well, is that actually we are starting to build up our working relationships with NCT as well, and we're thinking more flexibly about these young people that are accessing more core services, so the moderate to severe mental health difficulties that are coming with a complex range of difficulties that probably likelihood is that they include social care. So we're building into actually have social work in our CAMHS force to start that networking, to think about working collaboratively and thinking about a young person as a young person and not again putting them into those types of boxes. So that is there. He's actually due to start in 2 weeks. So, and he's at a band 7 level that's able to make autonomous decisions. He's got real good working relationships. He's got really good knowledge base. And again, it's working towards routine outcome measures for young people and families. So we're trying to think flexibly with that as well. Coming on to think about SALT and all that, we're trying to think about flexibly for our young people with ND, neurodiversity, and helping them access our services and our talking therapies, because not all of our young people will be able to access it as it is outlaid right now. So it's thinking about neurodiversity in young people and being able to access the service.
Thanks, Erin. That's great. And I think just to build on the point about measuring impact and so forth, just to mention that we're again investing in a quality improvement methodology now to do that sort of proper PDSA cycle, and also looking at then the data. And although not a mental health example, I guess I was struck, Claire, by some of the work that we were doing with our colleagues in children's nursing with the GPs, and looking at actually what impact we could have on A&E attendances with an earlier upstream intervention in general practice. So I think it's very early days, and I think you're right, it's certainly an area that we can look more at. We're equally doing some work in partnership with both the University of Northampton and Leicester to think about, as you say, there's some opportunities there for some proper research and to use the expertise and capability of the university, I think, a bit more effectively. And so I wanted to come back also then to a point that I think David raised in the chat that sort of cropped up in the discussion, really, which I think sort of Sharon illuminated in terms of the staffing pursuing opportunities to develop themselves, but potentially then denuding other services. Does anybody wish to comment any more in terms of some of our workforce strategies for children's services, what we're doing or what we're planning?
We are doing a lot of recruit to train posts. But unfortunately, that doesn't then keep them in CAMHS, those people that we're training up in psychological therapies, and that's been for the last few years. So again, that's another challenge for us, and not just us. I feel that's nationally. So we are trying things innovatively to try and think about how we can keep our staff and retain our staff. And there's a working group going on just now to think about that more widely. But yeah, it's thinking about skill mix and growing our staff. And again, when this whole new opportunity came for NHFT, it was a new opportunity. There was a lot of upskilling and a lot of that staff wanted to do, and we couldn't then prevent them from not doing it. But again, it then impacted our other service. And just touching on what everybody's been saying, we've now put this new service into place. It is a pilot. It is running extremely well. But the fact that is running well, it means that my service gets the moderate to severe, very, very complex kids. And that takes a lot of capacity within clinicians. And again, it does impact on wait times. and we are trying our very best to kind of upskill our staff to manage these complex situations, but also thinking about nationally keeping young people at home when we can and keeping them out of inpatient. So it is a very, very challenging position to be in. Because we are just trying to minimise the risk where we can, upskill our staff, and recruit our staff and retain our staff when we're putting all these new and innovative projects in that is going to help young people and family. But yeah, it's trying to think about it as a wider picture, and it's really difficult. So yeah, I can appreciate what you're saying, but yeah. We are trying our best at the moment, and I know anyway is too long. It is too long.
Thanks, Erin. I can see we've got another hand up. David, should we come to you next?
Thank you, Richard. That was picking up my comments in the chat. It's difficult to know exactly what to say. There's really very interesting summary of what's going on, but clearly lots of Northamptonshire children are struggling at home in all sorts of ways. We have comments from the government that they're going to provide a counsellor in every school, but then you hear that's about providing a minimal training for a few teachers to be a little bit more aware, which isn't a solution. It's a sticking plaster. I don't know where the solution is. I'm quite worried about it, and want to be encouraging to staff in NHFT because this is a national picture. And I put in the chat, I've been in social work, which is my profession, for over 40 years, and the discussions about CAMHS has been constantly there, and there's been a constant underinvestment. And thank you, those of you who are struggling with the challenges now. I know that's a mammoth task, and you need all the support and encouragement we could give you, and it's great to see the innovation, but as a governor of NHFT, I have to be worried about the long waits, and I know what that means for families who are just coping and absorbing. The second thing is just to say it would be just a little troubled to hear that the links with the Children's Trust are being built. I would have assumed there would be social workers in CAMHS teams. That was all my experience, and it's good to know that that is happening. But of course, social workers are in short supply as well, so that isn't a quick solution. And it's good to know that is developing, and there are good links. As a social worker, I was often frustrated at the lack of support that was available for children and young people I was working with. But it's good that that is being considered. So I think thank you for all the innovation, but there's a national challenge which is not your responsibility. Krishni said that in the chat. But we have to be worried as a community that there are young people there, and finding creative ways to provide support to them and their parents is one of the big challenges for us. And I don't have quick answers. I wish there were some. But so thank you very much for what you are doing, and sorry to be a little pessimistic. Don't be discouraged.
Thank you, David. And I think you're right. Certainly the executive team in the trust spends a lot of time thinking about workforce and putting solutions in place. As you say, it's certainly a challenge that's affecting the whole sector, actually. So I think you're right to highlight that. Thank you. So we're approaching our sort of final quarter of an hour. So I would encourage anybody that hasn't already asked a question to either put their question into the chat box or to put their hand up. In the meantime, we'll bring in Susan.
Hiya. I just wanted to say that I'm actually really happy that I attended this meeting today, because you can hear about all the good work that's being put in. I tend to come up with ideas, because the reason why I took this role is because of my lived experience. But I know that, like, for myself, one of the things that helped was helped me get out of my mental health was the reward system of like working in charity shops and stuff like that. And an idea that came to me, I mean, I know that you have to be legal age, so like the legal aspect of it would have to be covered. I think it's 13 or something. But like things about giving back to the community, I wondered like if anyone had thought of something like that, because the reward system that you give to yourself, the smile on your face, you know, it's like being given a compliment every day as such, that you can give to someone, giving something back to community. And I was wondering if that's an aspect that has been looked at all? You know, like working on a Saturday in a charity shop, or picking up rubbish, or do you know what I mean? Something like that, something that's very rewarding and makes you feel good for who you are, what you've done on your Saturday. And do you know what I mean? Things like that, really. I was just wondering if that has been explored at all.
Yeah, so Jo Fletcher, I think you can answer this one, can't you?
Yeah.
Thanks.
Thanks, Erin, and thanks, Susan. You're absolutely right, and it's so important. You know what you've described in terms of taking people together, making them feel part of something, and giving something back is really fundamental to protecting a young person, their well-being, and helping them in any sense of recovery as well. So we have a youth advisory board, and we have patient experience groups, and lots of opportunities for doing just that. So we do run social events, we run groups, we predominantly in a co-production space to understand how we should be developing our services, but equally making sure that those young people are rewarded. And actually, we had an event yesterday where we were looking at our children's services, and I did read out an account that was given by one of our young people who's spent years of her life in and out of inpatient settings. She's been extremely unwell throughout her life, and she described an ongoing war within her brain, but she's also described since being discharged for the last year, she's been working with participation, she's done training to be able to equally provide her expertise on recruitment panels. So she gets some financial reward, of course, as we do in the trust. But actually the most powerful part of this for her was being part of something and being recognised and being valued and being able to give something and being able to help others. It has made an enormous change for this particular young person, but that is very reflective of really all of the young people and many of the adults that we work with in that way. So your point's so right, and thank you.
Okay, thanks.
Thanks very much. I know certainly that's something that we're very much doing within our adult services, and it's part of the great dream, the Action for Happiness work as well. That opportunity, and I know Chris is very much involved in that. Okay, so I think we've covered the questions in the chat, but if anybody is thinking that we haven't answered their question, please do let me know. The chat box has been rather busy. Does anybody else have any other questions they wish to pose before we start to think about wrapping up today's session? No hands. Chris.
And again, as David says, you know, these are not easy issues to tackle, but I think one of the slides, sorry, let me just plug myself in. I can see from one of the slides about the health inequalities, you know, the number of our children in Northamptonshire have school meals or are subject to domestic abuse. And if we tackle those between us, then we can tackle what comes from that. And I know Naomi's on this call, and this isn't directed at you, Naomi, it's directed at all of us, that if we can address the issues, you know, around education, around income, about supporting families who are at risk, you know, about feeding people, let's get it basically right, then hopefully we can provide our children with a safe environment to live in. And if this was what the ICBs were intended for in terms of population health and people living better and living well, then that, for me, forgive me, I don't wish to be negative like David says, this is a really difficult issue. But that slide for me shows that what is particularly over and above the national issues of workforce and waiting times, there are some specific issues, aren't there, my friends, for what we have to respond to for Northamptonshire. So that if I may, and I don't wish to do a sharp handbrake turn here after all the good work that's going on, but there has to be something in that slide that challenges us to go better and further. Thank you.
Thank you, Chris. So yes, as you say, I think there's clearly an awful lot that's going on that is showing the work that is going on, but there's much more to do. And as you say, I think it's right to identify this as a sort of cross-society issue, isn't it? It's not something we can solve alone.
Absolutely.
And it's reassuring that
Absolutely.
some of the partnership working that we're already doing and that we will continue to do, I think will help us with that challenge. Sharon.
Yeah, can I just add a comment to that? Because the transition service that we are providing for young people, which, you know, helps to support them with food poverty and their finances and getting a job and getting into education and all of those things. I mean, it's very much in its early stages, but, you know, that kind of wraparound support for a young person is really important, not just to have the mental health intervention, as Erin was saying on the slide. It's not just about that. And I think that more and more we're able to provide more for young people. So a cafe that they can drop into at any time, intense counselling support when they need it, and then some practical support as well. So obviously it's a small number of clients that we're doing that for at the moment, but it is a start as to how services, I think, should be looking in the future.
Sharon, yes, I quite agree. So I think we've exhausted all of the questions that have come about. We've certainly had a really interesting discussion from my perspective, and I know it was mentioned earlier, but we will make sure to circulate the slides with all of the details and access numbers on for everybody. We'll obviously be publishing the recording on the website after the session so that people can revisit any of the topics and we can make it available to other people. So before we finish up, I'll just turn to Sharon.
Sorry, I have put it in the chat, but it is of note that we are geographically so vulnerable. You know, for children looked after, you know, Junction 15A services, children often dropped off by the lorry load at Junction 15A. We have that M40, M1 link. Kettering is the geographically most central town in Northamptonshire, and I do know that gangs and drug running, cuckooing, or, you know, the incidence in Northampton has risen exponentially, which I think really adds to our already very vulnerable population in those pockets. So it's just another thing for us to think about. And I was thinking about, you know, that what you were saying, Chris, about, you know, poverty and that kind of thing. And we are just in a really vulnerable position. So you can't really imagine how hard it must be for our children and families sometimes.
Thanks, Sharon. It's one of the scores, doesn't it? The need to work on a multi-agency basis actually with those sorts of bigger issues. And I think certainly with the ICB and the emerging place infrastructure, we stand a pretty good chance of coming together to tackle those things. So I think in which case, let's call things to a close. Thank you so much to Erin, who I know has just had to leave, to Sharon and to other Children's Services colleagues for putting together the presentation and for sharing some of the work with us this afternoon. Certainly it was really interesting from my perspective, and I can see from the chat others found it useful as well. So thank you all for your interest in the members' webinars and for attending this afternoon. Before we finish, I will just highlight we've got our next and final webinar for this financial year coming up on the 13th of March, the 13th of March at 4 o'clock, and that will focus on our diabetes service. So if you or anybody else is interested in learning more about diabetes and some of the work that we're doing there, again, you can register to attend that session online, which is 4 o'clock on the 13th of March. And I can see Tracy's put the link also in the chat. So with that, thanks again, everybody. I really appreciate your interest and contributions this afternoon. Have a very good evening. Thank you.
Thank you, Richard.
Thank you.
Take care. Bye, everyone.